Hello, my name is Abraar Karan, and along with Dr. Geeta Sodhi, I am one of the co-editors of the new crop book, Protecting the Health of the Poor, Social Movements in the Global South. Now, in our book, Dr. Sodhi and I explore some very fundamental questions in global health, including what is health, who is responsible for providing health, and what is the best way to do so. Our book is unique in that it brings together a number of case studies from around the world. We look at the region of Latin America. We have contributions from South Asia and a number of papers from Sub-Saharan Africa talking about a unifying theme, which essentially is how do we protect the health of the poor? Now, there is no real consensus on what health constitutes. The term is quite broad and involves a number of different fields, from medicine to public policy to economics to developmental human rights. Now, the question that comes up time and time again is who should be providing this care? Is it governments? Is it the private sector for its employees? Is it the public itself? And there are various viewpoints that examine these questions, those from academics, then we have those from activists, and the way that people look at these fundamental questions is very different depending on which lens is used. Now, one of the most important ideas in all of our papers is that of poverty and health. In what way does poverty interact with health? Now, identifying the vicious cycle, which is that the poor are often sick and that the sick in many ways become poor due to an inability to work and contribute to the economy, we find ourselves in quite a conundrum. Now, measuring development itself is quite difficult. How do we do it? How do we say what is an equitable state of governance? One of the measures is the Human Development Index, which looks at life expectancy, education, GNI per capita. Now, even there, we run into issues where it doesn't differentiate for inequality within countries. Thus, the inequality-adjusted Human Development Index was also developed more recently. But metrics aside, we have to look at the nuances within each healthcare system and each case study to truly understand what it is, which factors are at play that impact health outcomes. Now, in many of the countries that we explore, one of the major issues that we run into is the lack of a complete formal workforce. Now, many of the poor are working in the informal workforce, and in that way it's difficult to tax them and to create systems of public protection. Now, looking into the complex social and cultural barriers is a whole other aspect, and it's important to respect the way in which these aspects of healthcare in different settings impact the way that care is delivered and the way that care is received. Now, our book explores both the private and public sector. We examine the variations in these two sectors. And most importantly, we look at how these sectors interact with people on the ground, which we call formally the civil society. We've organized the book into legal, political, interventional, and multifaceted responses. From the legal side, we've got papers that look at the pharmaceutical patent process, the way in which innovation is regulated. We also look at right to health claims for life-saving medications. We have cases looking at large multinational organizations and the way in which they contribute to the healthcare enterprise. Now, we also look at a more microscopic perspective when we examine the work of NGOs on the ground. Dr. Sodhi's paper examines access to child health care, maternal health care, particularly looking at newborns in India. We've got other contributions from Dr. Monica Arora, whose paper examines tobacco cessation programs in India. We've got contributions from Dr. Perez Bustillo, who looks at indigenous peoples in Latin America, their need for recognition, and the potential framing of poverty as a crime in the legal system. In my own paper, I examine the case of Uganda and the socio-political forces in the HIV/AIDS epidemic in Uganda and how that impacted incidence and prevalence rates in the 1980s and 90s, and what lessons can be applied to more recently in the last few years where there are PEPFAR funding shifts, which will make it more difficult to guarantee access to antiretroviral medications. All in all, our contribution in this book is very unique. We have several different authors who have various perspectives. I encourage you to pick up a copy and to read for yourself and continue the dialogue with us as we try to utilize both academia and activism to protect the health of the poor around the world.